And so now I'm going to introduce our next speaker and closing speech from Meena Purushothaman, who is the Assistant National Breastfeeding Coordinator with the HSE, and which that office has key responsibility for driving the implementation of key actions within the HSE's Breastfeeding in a Healthy Ireland Action Plan 2016 to 2012. So Meena has a wealth of academic and clinical experience in training and as a training and development coordinator, specialist midwife and IBCLC. She worked in the National Maternity Hospital and Coombe Infants University Hospital, and in various roles providing support to parents, their infants and fellow health professionals alike. So welcome, Meena.
Very good evening, everybody, all my colleagues in breastfeeding, all the supporters of breastfeeding. I can't thank you enough, Elizabeth and Sarah, for inviting me. And I only stepped up in place of Laura, who has lost a close member of her family. I'm so privileged to share a platform with such eminent people. I'm so honored. Thank you for having me this evening. So I must say, I have never celebrated a breastfeeding week as eventful, as resourceful as this 2020 breastfeeding week. I had been celebrating National Breastfeeding Week since 1995, and I have to say, probably due to the COVID situation, all my colleagues will agree that we have celebrated in the best way possible this year. Starting with the ALKI conference the week before, we had a series of webinars. Normally, we used to have a lot of activities in the hospitals and public health areas, whereas this year, we, the supporters of breastfeeding, had such wonderful webinars and from such inspiring people from all around the world. So I'll say we are all equipped much better to support the mothers going forward. So I thank Laura for kindly supplying the slides for me to present for today. The HSE Breastfeeding Action Plan, we focus on the 5 elements of it, which is improved governance and health service structures, breastfeeding training and skills development, health service policies and practices, and support at all stages of the breastfeeding continuum, research, monitoring, and evaluation. We have the data for breastfeeding rates in Ireland, which is from the 2019 IMIS data. We have 63.7% of mothers were breastfed at first feed following birth. And breastfeeding on discharge, exclusive and non-exclusive, is 63.4. And breastfeeding on discharge, exclusive breastfeeding, is 37.3. That is very low. We can also see a little hopeful here when you look at here, breastfeeding at first PHN visit, exclusive or non-exclusive, it is 57.9, but breastfeeding at first PHN visit exclusive has improved to 42.2 here. And breastfeeding at 3 months checkup, exclusive and non-exclusive, it is 41.2, and at 3 months exclusive breastfeeding is 31 and 31.2. Components of the HSE Breastfeeding Action Plan: improved governance and health service structures.
Sorry, I think we've lost the audio there for Meena.
Yeah, she's trying to reconnect again.
Okay, thank you, Sarah.
We have recommendations for the establishment of infant feeding committees in the community services. HSC infant feeding policy updated and breastfeeding observation. The board was developed in 2018. 3 new posts for hospitals were sanctioned for additional lactation consultants, and 4 vacant or retirement posts were filled in 2020. And community services prioritizing posts with public health nursing services are on way. The 2 policies are awaiting launch, which are breastfeeding policy for public health service employees. This was meant to be launched, approved by end of February this year, but because of the COVID situation and restructuring, this was delayed, and it should be implemented very soon. I would like to say that I had received a lot of emails during the COVID period from mothers who are employed in HSA looking for this policy. And today's talk was so enlightening that I used to the people who have contacted me that it is unfortunate that we need a policy for a mother to continue to breastfeed at her workplace. So, as in one of our today's, James Acre, he mentioned that breastfeeding is a human issue. So I used to reply to all my emails saying that it's not having the policy signed off and you implement the plan. You are a mother going back after your maternity leave, and you're requesting your managers or your team to afford a few minutes for expressing or having to feed your baby. So it is unfortunate that as human beings, we have to have a policy in place in order to allow a mother to continue to feed the baby with the best food. So we have to think in terms of a human issue when we consider breastfeeding. The other policy that is completed is HSC marketing of breast milk substitute policy and user-friendly staff guide to working within the policy. And we hope that this policy will have very clear guidances for healthcare professionals working in the HSC and in our hospitals. The other related policies are breastfeeding included in the first 5, a whole of government strategy for babies, young children and their families 2019 to 2028, and breastfeeding observation assessment tool, and guideline developed an infant feeding policy for maternity and neonatal services, as well as for the primary care teams and CHOs. We launched the mychild.ie website. Our parents need to have reliable, evidence-based, trustworthy information available as part of the HSC service. So this new child health website is launched, and along with that we have the My Pregnancy book and 2 My Child books, which is 0 to 2 years and 2 to 5 years. And breastfeeding.ie and Ask Our Expert service is integrated with the My Child since July 2019. And there is campaign for additional resources being targeted towards breastfeeding. So our Ask Our Expert online lactation consultant support, we have seen an increase in 57% of the chats and requests for Ask Our Breastfeeding Expert service during the time of COVID from April to August. And mothers have reported back the 2 books, in addition to the My Child Pregnancy book, has been excellent and very positive feedback on the books. This is a survey conducted about Ask Our Expert service. And we found that 25% of the questions were about pain with breastfeeding, including issues with mastitis, and 24% of the questions were about frequent breastfeeding. 23% was about latching on to, and breastfeeding and tongue ties. And 22% was about expressing and storing milk. 17% was on quality of milk, if baby is quantity of milk, if baby is getting enough or not, and if the baby is gaining weight sufficiently. And 16 was about stopping breastfeeding, and 10 was about combination feeding, formula and combination feeding. 10% of questions were about taking medications while breastfeeding, and 9% of questions were about going back to work. And 9% of questions were also on about stools and weaning. 7% of the questions were about night feeds, and 5% was about pregnancy and pre-breastfeeding preparations, and 3% of the questions were around drinking alcohol, and 2% focused requested where they can find the support. Overall impact of the overall impact of Ask Our Expert service was that 64% of the mothers agreed that they felt more positive about breastfeeding after using the service. And again, 64% said that using the service improved my breastfeeding journey. And the support, 61% said that the support provided by the service encouraged them to keep going with their breastfeeding journey. And 41% said that I breastfed longer because of the advice and support provided by the service. During the period of COVID-19, we were constantly seeking evidences around COVID and our guidances. And it was so great to have today's presentation. And we are constantly looking for evidences so that we have the best guidances for supporting and protecting breastfeeding. So the COVID-19 had impact on families and relationships and feeding. We saw it throughout our presentations today. We developed the guidances, recommendations for breastfeeding during the COVID-19 pandemic. And the HPSC guidance for care of pregnant women and postnatal care was developed. ALKI, in association with the Association of the Lactation Consultants Ireland, we have developed a guidance for private practitioners' work. And a guidance for the voluntary breastfeeding support groups opening up was developed, but again, we went back to level 3 of lockdown, so which hasn't helped us a lot. Virtual breastfeeding support has become a part of our future. It is becoming a part of our future. And our breastfeeding support, voluntary support groups have done extremely well in this. That Lalach League, Kudu, and Friends of Breastfeeding, they have all had virtual breastfeeding support groups set up and regular meetings, and which has helped mothers to access the support from all around the country, which is fantastic. And as I mentioned, that Ask Our Expert service, there was a 57% increase in demand during April to August. I just want to thank everyone for supporting our mothers, babies, and families for a better society. And I'm sure today's session was such a finale of our National Breastfeeding Week celebrations. We had speakers from all around the world, and such inspiring, starting with Ms. Sabina Higgins' inspiring speech, and until now. And my presentation is only a wrap-up of bringing back to the reality of how we can go forward in Ireland. So thank you everyone once again, and hope we are all equipped with better information and we can support them in a much better way in future. Thank you one and all.